Here it is.
Wow. We'll carry another minute or so and then we'll get started.
Hi, Jerry. When's the best time to try to reach you by text messages or phones or something? You know, I try to talk to the board before we meet.
Me anytime. I mean, you have my cell phone, you can text me.
Okay, I didn't want to, you know, barge into your world, but
There's never an ideal time, so barge away.
oh, thanks.
Okay, well, maybe we should get started, and I'm sure Carrie will be along in a moment. So let me call the meeting to order and review tonight's agenda. So we have public comment, of which I don't believe we have any members of the public on the call. And then Mary is going to Juliana is going to update us on the role of nurses with respect to COVID. There was a meeting earlier this week, and it'll at least give the board a chance to kind of understand how the school nurses are involved in this battle with COVID. And then right after good policies, Mary has to leave to go to the school committee meeting. Hopefully, Mary, you could stay for that discussion. It shouldn't be that long. And then following that, a discussion of the select board COVID policies and what's transpired in the last week or two. Then we have an update on the Mapc project, hopefully finalizing it and moving on to get that started. Kevin's going to give us an update on the coalition. We have our usual monthly report, review of the minutes and approval, and we'll be all set. So without further ado, why don't we turn this over? Maybe Peter, do you want to introduce Mary? And
I don't mind introducing Mary. I met her in person just about a week ago, and she's, you know, has a reputation that precedes her, of course, but she's a very capable nurse and a lovely lady. And I say that because, you know, we talked about some controversial items, and, you know, she was very understanding about how that operates. And it was really great, you know, being in sync with somebody who I've never met before. And so now when we wrapped up our meeting, and you do have the agenda and some of the notes from the agenda, but I thought it might be important if we would just kind of focus on the epidemiology that the school nurses are practicing now. This is kind of new. I mean, we've always been in touch with school nurses. As far as I know, in public health, every place I've ever worked, school nurses have been part of our daily routine. But during this, I mean, the contact tracing is new. And so I call these folks epidemiologists, and Mary seemed like she was okay to do that. So I'm going to just welcome her now, and we'll just hear how she dovetails in. And I think that's Christine down in the lower right-hand corner, at least on my screen.
Yes, it is. Good evening. Yeah.
Thanks, Christine. And maybe some of what Mary says you can just kind of elaborate on when you feel it's necessary. So no further ado.
Sure.
Go ahead, Mary Juliana.
Well, thank you, Peter. Thank you for your kind words and for meeting last week. I think it was also a very productive meeting, and just grateful for this collaboration. Christine and I met April 1st, 2020, and we've been working together ever since. And I do appreciate the nod calling us epidemiologists, but I would say that I have the utmost respect. They're rock stars to me, so that's a compliment. But I think we all consider ourselves public health nurses, school nurses, which is part of the job, and it has really come to the forefront in the past year and a half. So thank you for saying that. As part of the town team, like I said, with Christine, we've worked really closely with Elise Warren and now with Schwung. We've been working together, to follow up cases in town. And so the school nurses, myself and Sharon Grotkow, had MAVEN access, which is the Massachusetts Epidemiological database. And so when new cases come into town, they're given a number, and then there's a public health nurse that follows up. Sometimes over the past year and a half, when there's cases in the schools, the school nurses are the first to know that someone's tested positive because it hasn't come through the MAVEN system yet. And so in that situation, we would sort of do all the data collection and the contact tracing, and then notify our public health colleagues that case number, whatever the number is a student in our school. We've already done the contact tracing. Here's what you need to know. And we kind of collaborate. And that has continued. And that even up to today, when Christine notified me that there were a couple of younger children who will be entering school in a couple of weeks. And I told her that I'd spoken with some teenagers who had tested positive. And so we have that collaboration where we're both working the system. And that's worked out really well. So I think we hope to continue that. Sharon was she covered every Saturday doing contact tracing for the town, not just the school cases, up until recently. And the decision was made just to have, I think, me be the point person in the town. But all of the school nurses are very well versed in the Department of Public Health guidelines. It changes frequently, but we keep up with it, and they're all very capable of doing the contact tracing, giving the guidance, and figuring out who needs to isolate, who needs to quarantine, and doing that follow-up on testing. So that we expect to continue this year. We'd hope there would be very few cases. We're in a different situation than we thought we would be at the beginning of the school year.
Point, you're sharing directly with her to take what's beyond the school and do the contact tracing when necessary.
Correct. So we would say something like, for instance, the case number, this is a student who was in school on this day. We've isolated the classroom and we've determined who the close contacts are. However, they may be grandparents, cousins, the birthday party, other outside events, that need follow-up, and that would be the public health nurse would help us to follow up on that. Does that sound right, Christine?
It does. Thank you, Mary.
And Christine has also helped us identify clusters. So when you have a number of cases that are kind of linked, maybe there was an event, there was a hockey game, and now we have 3 or 4 kids, that tested positive, or a coach. She kind of handles a lot of that for us in terms of contacting the epidemiologists and creating those links among those different cases as well.
Carrie?
Hi, Mary. It's nice to see you.
Good to
Hello,
see you.
everyone. I apologize. I guess I was late. It was 7 o'clock in my kitchen. Who knew? Mary, I just want to note that Reading is doing it a little bit differently than was expected. It was never expected that school nurses would be doing contact tracing. It was always very clear that that was a public health responsibility. And I think it's great that public health and the schools were able to work together and find a way to share the burden and do that communication. So I just want to acknowledge that. That's not something that happens in every community, and it's not expected. It's not the automatic, is what I'm saying. So
thank you. I think we're happy to help in the community because it's our community too, and it's what happens in the school it's not isolated. So yeah. I think if we can keep kids safe, we can keep families safe, and it will be helpful to all of us.
Yeah, that's great.
Mary, can you talk about the role of the nurses with respect to the pool testing that had been going on in the previous school year? I don't know if it's planned to going forward, but did the nurses actually administer those tests, or did someone else do that? How did that work?
So DESE will provide support, and they did. They sent out we had some medical assistants, some certified nursing assistants. They sent a team who would help us. The nurses in the buildings were sort of the coordinators of all that. For the most part, that staff, they were sort of bringing them around. They were doing all the prep of what classes were being tested when, which students may need some extra assistance when they were being tested and that sort of thing. And then kind of being the coordinators on site. Up here at the high school, to be honest with you, in the preschool, I did a lot of the testing with, we had some volunteers, we had our athletic trainer, we had some of our retired nurses who came and did that with us because we did it after school. So the DESE staff typically wasn't available then. So we sort of did our own thing here and did most of the testing on our own. And then again, in the preschool, we ended up doing, I ended up doing some of the testing just because of the population and the staff. So it was a mix of both, but the nurses on site were doing that. The pool testing that we did in the spring, it was when there was a positive pool, the nurses were doing the reflex testing. So if we found out there's a positive pool and it was in first grade, this room, we would then do the follow-up testing with a Binax Now to find out who that positive was. And then the nurses, we were doing all of the contact tracing after that to figure out who else might have been a close contact of that student who tested positive. So all of the follow-up part also fell up on them. So it was kind of the coordination of the actual testing and then the follow-up, but the tests themselves. And now DESE has just said with the pool testing, two things: they can do in-lab follow-up, which would be helpful if we do pool testing, and also anyone kindergarten and up can swab themselves. Previously it was K-2 needed a clinician to swab them. So, but the pool testing that they're offering now is just one out of 3 different testing modules that they're providing. And I'm not sure the thing to start the year off with pool testing. I think there might be a place for it, but the other 2 things that they're offering are symptomatic testing with the Binax Now, which is that rapid antigen test, and also something called test and stay. So if there were to be a positive case where a child was in school and then was found that they were positive while they were in school, those close contacts who were in school would be able to come back to school and get a rapid test every day during that period where they would have had to stay home. And I think that might be something worthwhile because 1, we haven't seen a lot of in-school transmission, and 2, it would enable more children to be in school and learning and hopefully staying safe as well. So I would support that, given that we did not see a lot of in-school transmission. And those Binax Now tests, those are rapid tests. DESE had said that they would be able to send us some support with that. Typically those are done by nurses. And I'm looking into ways that we can have other supports maybe to do some of that testing if that's something that we adopt.
Good, thank you. Any other questions for Mary or comments? Carlo, yes. You're muted right now. Okay.
Do
Do you have enough staff for the school for pool testing?
So, like I said, DESE will send out a team, and they did send us out a team of testers. So the problem with that is you're hiring people for short term, and so they weren't always super reliable. We did have to do some training of that staff, but they have said they will send out staff if we request that. I'm not sure how it works if you're doing the test and stay, if you have different. I'm not sure. You would want everyone tested first thing in the morning, right? Because you don't want a kid to stay in school all day and test them at the end of the day. So we need some more information from them. We're in the process of doing the application, and we would take any help in terms of that. I'm wondering if we had, like I said, we're sort of creative with using some of our retired nurses and some other staff with the athletics testing. If we could be creative, that might be more worthwhile, but we will certainly accept DESE help for that. The contact tracing piece and just the follow-up is a large burden on the nurses. I'm grateful for Paula, who is a substitute nurse for the Reading Public Schools, and we really appreciate her help and her expertise as well. But I am, and for the town side, you should know this, applying for a grant through the state to provide extra per diem nursing support, just in general, because it certainly was a taxing year last year. And all of the screenings and things that were on waivers last year that we really need to get to this year, we'll be doing those again. So we definitely could use some extra help in schools.
Okay. Any more comments? Anything else, Mary, that you'd want to inform the board about?
Well, I have a question for you, because I know that the school committee is anxious to know, we've been looking at, we obviously have some cases who are younger, students and teenagers, children and teenagers, and we also have some positive cases who are previously vaccinated. So when we look at, our masking protocols, I think those are important things to note. One of the concerns people have if we're reopening schools, in this way, what metrics would we look at to see if things are getting better? Because obviously we're not in a place that we wanted to be opening school, but I guess I'm optimistic that perhaps things could change and things could get better. What are the metrics that you would want to follow to see which direction we're moving in, and when we would make changes on our policies from a Board of Health perspective?
So maybe in terms of that question, we can kind of move into the next agenda topic, because I think it kind of fits with that. And so just as background for everybody, and if you've read through all the pre-board packet, it's kind of all there. But basically, DESE has put out guidelines for the schools that are perhaps a little less restrictive than what a lot of other organizations think should be happening. The DESE guidelines, basic 6, and then masking only unvaccinated 7 through 12, and doesn't really say a lot, I think, about staff. I'm not sure. Whereas some of the material we sent out, the CDC and the American Academy of Pediatrics, the Mass Medical Society, and the Massachusetts Association of School Committees all recommend universal masking K through 12. And so the state has been pretty adamant they don't want to micromanage this at the district level for whatever reason. And so the school committee here in Reading met on Monday night and took as a prototype the policy that the Massachusetts Association of School Committees put out around universal masking, and made some amendments to it, some operational type amendments of how it should be done. And then, as Mary said, included a list of metrics that they would be looking at to determine when this policy might be rescinded. And they committed, that's the comparison of multiple organizations, pretty much all recommending masking. And they came up with a set of metrics that they would consider looking at, and those included things like incident rate, percent vaccinated in school. I'm trying to remember them off the top of my head. I think there was whether there are a lot of cases in the town or in the school system. And they were included in your materials. So I guess the reason we sort of put this on the agenda for the Board of Health is really, in my mind, it'd be a couple things. One is I'd like to hear from the board about how they feel about this kind of approach in terms of essentially universal masking with the usual exceptions. for the school? Do they? And I guess secondly, I was actually going to ask Mary, whether there are other metrics besides the ones that the school committee had listed in their edited policy that we think might be useful. I can mention that, I can mention that I do have those metrics, which are vaccination rates per school, students and staff, case rate in Reading and Middlesex County, incidence rate in Reading and Middlesex County, and cases and transmission inside in Reading and inside Reading public schools. So those are the metrics they had. So that's what sort of this discussion should, I'm hoping to elicit is really the feeling of the board around this approach. So, I mean, I could start off, and I would just say that, I fully endorse universal masking of students K through 12. I think that, having, not only for students, but for all staff in the school. I think the state has already said that they do not want remote learning. And so it's just absolutely critical that, students are protected as much as possible. And so from my perspective, I would certainly endorse that. In terms of other metrics, it's interesting, Mary, you thought that maybe pool testing wasn't something that we should start off the year with. And I was thinking, actually, I'd like to hear your thoughts on that, because I was thinking, gee, wouldn't that be an extra level of protection? And the percent of students who are enrolled in the pool testing, if there was a very high percent, that would give you more confidence that we were tracking things early. So what do you think about that? About the
Excuse
pool
me,
testing?
is this shared screen distracting or helpful?
Yeah, I think you can take it down now.
Okay.
But can I just, I'm sorry, I'm just trying to find in my packet the place that talks about metrics that would perhaps justify changes in the mask policy, and I can't find it. I'm not sure what's the title of that handout?
There was a policy. There was a policy that Schwang sent out that was the original Massachusetts Association of School Committee. And then there was another policy or document that I believe Peter distributed that sort of looks like that. It has this new mask policy.
Got it.
And on the second page of that is listed, these are the edits from the school committee meeting Monday night. It listed those four metrics.
Got it. Thank you. Sorry to interrupt. I needed to get caught up.
Sure.
Thanks.
Mary?
So we did pool testing, and I think we had a similar experience to many other districts in that you needed consent from the families, and we probably I don't even think we made it. Maybe 50% were involved in pool testing. Don't quote me on that because I'm not sure, but it was less than we had hoped. Certainly, the one thing we did at the high school level was we mandated, because it had to be consented and optional, but we mandated that anyone participating in after school athletics and drama and activities be tested. So we were doing hundreds of high school kids weekly when we started in February and March, which was helpful. And then as they got vaccinated, they could opt out of the pool testing. And if you read the DESE, when they talk about testing, it is recommended for unvaccinated, but it's not recommended necessarily for fully vaccinated individuals. So now that we have close to 80% of our high school students who are vaccinated, it would be a smaller population. And I think DESE is trying to promote the pool testing. They're now calling it weekly COVID safety checks instead of pool testing because they want to have more people on board with it. So I think if we had, universally everyone testing, it would probably give us more data. As it was, we did 3,000 pools and each pool contained 4 to 10 individual tests. So that's up to 30,000 or so maximum tests during the whole program. We had 24 positives and another 4 that were initially inconclusive that we found positives from. So it was a very, very low incidence, which was reassuring, I think, to a lot of people, but it was a lot of work to do that. So I'm not sure we got the data that we wanted from it. And it's once a week. So there were times when we would test on a Monday and a kid would test positive on a Thursday because it wasn't, it was just being done randomly that way. So for those reasons, it doesn't seem to be, I think it's a tool that we could use and say, and Peter did say this to me, it wasn't the way epidemiology works, but if, or public health works, but if there was a school where we noticed there were a number of cases, that maybe we pool test that school more, regularly, and maybe more of the parents would be on board with pool testing for a few weeks in that school because they've had more outbreaks. But I'm not sure. I'm not saying that we wouldn't do it, but because of the amount of work that it took to get it all done, and because we didn't have everybody involved in it, I'm not sure it's the first step that we should take. I think some of the other, I think the symptomatic and the test to stay, where we can actually keep kids in school, might be more helpful. I'm not sure. It's until we actually go through it, we won't have that data. But does that answer your question?
Yes, it is. Yes, it does. Thank you. So comments from the board about either this approach, the universal masking approach, or other metrics? Yes, Carrie or?
Here we go first.
Once, twice, 3, shoot, Paula.
You go ahead. Go ahead.
Thank you. And I had seen that document. I apologize. I just hadn't put it. I received it from Peter. I had reviewed it. I just hadn't put it into my stack of papers. So, okay. So I too am in favor of universal masking. I think that it's helpful for protection for the population, and that is the purpose of public health interventions. We aren't engaged in protecting the individuals. I'm not a clinician. We are not acting as clinicians in this capacity. We are looking at the interventions that will provide the best protection to the population that we need to be considering. And I think that universal masking is an excellent approach. In terms of the metrics, I am absolutely in favor of the school committee getting that information. I think that's great. However, I would not be in favor of them being used as metrics to guide a decision about rescinding a masking order or guidance. I don't think that they are appropriate measures, because what they measure is the success of the intervention, and taking the intervention away changes the conditions. It's not an engineering project. It's not one of my IT database projects where I've got 40 sets that I've got to get installed. We're not striving to completion. We are striving to provide a safe and protective environment that is healthy for all of the folks that are present in the building. So I think monitoring that data is very important. But those aren't the reasons that you're going to make a decision about whether you rescind the mask decision. I'm happy to discuss that further, but those are my 2 very clear statements.
Great points, both. Thank you.
Thank you.
Paula?
Yeah, I agree with it as well. The universal masking, especially where the infections that we're seeing, there is a fair number of the infections that we're seeing with Delta are despite vaccination. So we need to be more protective of the population. I'm a little bit worried about pushback from staff because there was some of that last year, and I haven't got a sense of where people feel about, how people feel about that now. I don't know if anybody else has any information on that.
On staff vaccinations or staff mask wearing?
No, about masking, universal masking.
I actually think I had read that the largest teachers union in Massachusetts a couple days ago came out, asking the governor to go with universal masking in schools, including staff and students. So I actually think that the teachers are on board with this.
I'm glad to hear that. Yeah.
Yeah.
I was reading through the mask, MASC mask, and it said I thought I read that they were not requiring it for phys ed, and that I was a little puzzled by that.
I think it was
Because I
that
think-
they were not requiring it for phys ed. Actually, the school committee made an amendment specifically to that, saying that if phys ed was outside, it wouldn't be required. But if phys ed was
That makes
inside,
sense.
it would be.
Mhm.
So
Yeah,
so
that
the
makes
edited
sense.
version, I think they actually addressed that.
Mhm. And
Okay,
we're
thank you.
going to encourage outdoor phys ed as much as possible. And maybe when they're inside for days like today, they could do their health classes or switch things around so that they're not running around as much inside with masks on.
Yeah, and would that go the same for things like chorus and band and the like
I
they
think-
did last year?
They did last year. I don't think there's as many restrictions this year with chorus and band.
At least not right now.
Mhm.
Right.
Correct.
Jerry, what do you think?
Yeah, I'm in favor, but I did have a question back to something you mentioned, which is, and I don't know this, does the school have a backup plan for remote learning at this point? And I guess, how do they see masks as protecting against having to go to that?
The schools, Jesse is saying that we're not going to be doing remote learning, so it's not an option. So that is coming from the state. So there's not a backup plan for that. However, and this may segue into the next point, the close contacts, the definition of a close contact in a school is different than the definition of a close contact in public health in general. And so they have said that students who are wearing masks are through school are not considered close contacts, and students who are wearing masks on a bus are not considered close contacts, even though outside in the world of contact tracing, those situations would be different. So that to me is even more of a reason why kids should be wearing masks, because that means there'll be more of them who will be able to stay in school because they won't be close contacts. And also, if there's a child who's identified as a close contact from a school situation and we do the test and stay, the DESE guidance is they wear masks the whole time that they're in school during those 7 days from exposure. So that's the
So if they're
guidance.
not wearing a mask in school, they could be considered a close contact.
Correct. It's typically 6 feet if you're within 6 feet for more than 15 minutes inside. But if you're wearing a mask and you're in school, it can be within 3 feet. So if in the high school, for instance, and if you're fully vaccinated, you do not have an asymptomatic. And if you've had COVID in the past 90 days. So for the high school purposes, a huge percent of our kids are vaccinated, so they would not be close contacts unless they became symptomatic. And they typically would sit in their seats, which are typically 3 feet is not a huge difference. So for the majority of them, they won't be close contacts. They won't have to quarantine. And the situations where we were seeing lots of kids quarantining were in the lower grades. So, if they're keeping their masks on, in a 4th grade classroom, not every kid in the classroom is necessarily going to be a close contact then. So in the ones who are, perhaps we can do the testing.
Yeah, so I think the only other thing I was going to say is about the next. Would it be helpful to have days missed from school due to quarantining or some other item, if the goal is to keep them in school?
Yes, that's a good point. We should track that. And there's no change in if you test positive, it's 10 days from symptoms or a positive test. So those kids will be out of school, but it will be like traditional sick days, that they would do. We call it asynchronous now. They'd have homework to do if they're feeling up to it.
So Jerry, I missed your suggested metric. Is it the percent of What was that again?
Yeah, so it was days missed from school.
Days missed from school.
Yeah, so, I mean, it's probably gonna be low because we don't have, sounds like there's not a ton of transmission, but still, I think that's a relatively straightforward metric for a school structure.
Kevin, any thoughts on this? Or?
Yeah, I just have a few questions. So, Mary, you mentioned that you were hoping to be in a better spot going into the school year. What's the difference this year to last year? Is it a big difference in number of kids that are going to be attending schools at currently?
The number of children who will be in school. Well, at the end of last year, after April vacation, we had everybody in full time in our schools. It was more that in the state, I think there was one day where I saw there were only 30 new cases, and now there are 1,300 new cases. So it's more, I think I mentioned we as like a, just in general, public health wise, so.
Okay, so I wasn't sure if all of a sudden we have more kids in town that currently have COVID than we had at the beginning of the last in-person that they were in for.
I think it's going to be interesting. I think this is a pivotal time because all the kids will be coming back together. So I do think it'll be a pivotal time to see what changes. We are seeing, like I said, I know of 2 high school cases in the past 2 weeks. And then Christine notified me of 2 younger students, from this week as well. So who haven't been in school yet. So if they had tested positive while they were in school, that would all be affected. So it's too soon to tell it. But in saying that, I meant that in general in Massachusetts, I'd hope that we wouldn't have the cases. I took down the mask signs in June when things were looking better. So, and it was really encouraging that so many kids were being vaccinated. And as Paula said, with the Delta variant, we are seeing positive cases in those who are vaccinated. They're not getting as sick, but we're seeing the positive cases. So those were the concerning things.
Right, the majority, for the most part, it's only 95% effective. So we figured we would see those cases come up as they arrive. But it was very good to see that the high school had a 95% 1-dose vaccination, 89% 2-dose vaccination rate, which I thought was great. I thought it was probably higher than I would have bet money on.
The high school's a little bit lower. That's from the town 16 to 19-year-olds, and I think it's a little higher than ours. And I think it's because it includes college kids who are being mandated to vaccinate. But still, our numbers are more. I think it's 77. With 80% and 77 2 doses, which I still feel really good about. So.
Okay, well that's good. Okay.
Mm-hmm.
All right. With this one, it's interesting. I know everyone's looking at these for data points. So we're looking at for data points of when we can unmask again, essentially, is that?
What the school committee, listening to the conversation, first of all, they were very adamant in not targeting very specific numbers, that if we reach this number or that number or that number, we would automatically do anything. So it wasn't so much around, very specific targets. It was about looking, what data would they be looking at to make a judgment? And yes, it was around unmasking. I think that, or at least going one step down to the DESE recommendations, which are a little bit more loose. Mm-hmm. But I think, I think that, so one is that they weren't, this is not black and white. This is this will be the information we're looking at. They also said that they would review the policy every, I think, bi-monthly, because they wanted to send a message to the public that this is like not ad infinitum. This is, we're going to be looking at this data set and we're going to review it every 2 months to determine. With respect to Carrie, your comment, I think these metrics are in the context of what's happening, frankly, statewide, probably as well. If we see by a certain time that the surge and the incidence is very low and these numbers look positive, yes, it's because of the outcome, but it's also because of the context of the entire, where the viral transmission is at that time. And then they may make a decision, to rescind universal masking, maybe go to DESE, although they weren't that specific about it.
So,
based on
so I
this
think the question that
conversation-
I would have,
Go ahead.
the question I would have is probably the question that most people in town would want to know, which is at what point will we remove the masks from kids in school? Is there a data point for that?
No.
See Carrie shaking her head no, and that.
No.
I mean,
So
Yeah.
yeah,
so
it
right,
just
right
isn't-
off the bat, if we're talking about a zero-sum game, right? It's zero. The number in the state, town, everything's zero. Take the mask off. I don't know that that's the best way to go about it. I don't think we're going to get there. So
I don't
think
know.
if we're,
I don't think
if
anybody
we're
thinks-
saying that's
No.
the outcome, then it's not going to happen.
Right,
We're going to be living with this for a while.
right.
So I
Let's-
think has there been any negative look at doing something like this from a mental standpoint or a physical standpoint as far as shutting down the kids' immune systems? Because I know nobody got sick last year. I know when I got contracted a head cold from my daughter's friend this year, I was sick for 3 weeks with a common head cold. And yes, I tested and followed all the protocols, but it was 3 weeks for a head cold. My immune system was completely shot. So I want to make sure that if we're going to do something like this, I feel like we're looking at one data point, and that's fine. It's stop transmission. I get it, understand it fully, and I'm 100% on board with it. But we should look at the full scope of things, not just that one data point. If you're going to make a decision like that, you should know exactly what it is you're recommending. Because right now you're recommending one data point. That's
So
it.
where's the other data, Kevin? Do you know where we can go to get it?
I have no idea where we can go to get that. I was hoping you folks might know that idea. But, you know, I've wrestled with this because of that. I always hate making decisions with only one side of the ball, so to speak. I don't, you know, it might be the right side of the ball and it might find out that, okay, no, there was really nothing there and it looks like you're in great shape. Great. But I think, you really need to make decisions like this, having the full scope of it before you do so. Just my 2 cents.
I'll provide you with some information from the American Academy of Pediatrics, answering some of those questions about, is this harmful for kids to wear masks?
Okay, great.
The truth is there's not a lot of data, but I'll send you, I sent it to Dr. Milichewski this morning. So just what we do have. There's not data that shows that it's harmful to kids, and there's some doctors answering some questions about, what you up. Going into this fall, there's been brought up that RSV is a little bit stronger, which is a typical virus that is a little bit stronger in some, but kids who are getting RSV and COVID are getting really sick. So if we can continue to prevent, these respiratory infections, it's probably good while COVID is still active. I would suggest that that's probably a plus of wearing masks, to be honest. But I'll send you these things that I had. I couldn't come up with a lot. We haven't been doing this all that much, but for long enough for there to be a lot of data. But I'll send you what I have.
Okay, that'd be great. And then, well, I was going to talk about something related, Carrie. So go ahead.
Okay.
So I just wanted to respond to something you said about a single data point, because I guess I don't see it as it being a single data point. We're looking at the single data point. One single data point is what's happening in the schools. But in that, I'm looking at what are the vaccination rates? What are the transmission rates? Do we have testing rates? And then it's what's happening in the town, because we know from last year that sometimes there were clusters and it was predominantly school-age kids. But the town itself, the balance of the community was not showing the same kinds of case levels. And then I'm looking, county. And I'm also looking at, to the extent that we have the information, I'm considering what do we have, what cases do we have that are wild COVID, what cases are Delta, what cases are Gamma, as Gamma starts to appear, and then are there other variants that are coming in? So I see it as a little bit more fluid and varied kind of data sense situation that I'm considering. I agree with you that the going down to zero is I don't think, and no,
It's not going to happen.
it's not going to
Not
happen.
going to happen.
And I wouldn't want us to wait for zero. That's not something I'm considering as the place we go to. but there are just so many variables that we're keeping track of. That's how I see it. I just wanted to respond to that. I don't know if that is
Right.
helpful.
No, it is. It's a little different than what I was suggesting. My suggestion was we're looking at it from what's the easiest way to make sure that we're not having kids transmit in school, right? Everybody wears a mask. It's pretty simple, right? But that's the only one we're looking at. All these things that you just described are variants around that, but that's still the one thing we're looking at. We're looking to try to keep the transmission in schools to zero, right? That's obviously that's the ultimate goal. And again, that's fine. I completely agree with that, and I'm on board with that. I just want to make sure that we're looking at the whole thing. If you're going to make somebody wear a mask, I just want to make sure that there's no negative effect to that. And obviously, we know in some people there will be because of just the way their respiratory issues may or may not work against it. But I just want to make sure that we're not just only going to say, well, it's the thing that stops the transmission the most, so we don't have to look any further. That's all I'm saying.
I should mention, go ahead, Jerry.
I was just gonna say, I think the goal is to keep kids in school, not prevent all transmission. So that should be.
That's a good point, Jerry. Yeah.
That is a good
That's a
point.
good point.
I should mention also that the school committee talked a lot about specific situations where a mask would be problematic, like someone who's doing a speech therapy, a student's doing speech therapy, learning some foreign languages, where looking at how the mouth moves is important. And they talked about maybe, whether they would use masks that have that are see-through or use face shields. So they are, with respect, Kevin, to, detrimental situations, they are thinking about those specific types of things.
Okay.
And
so just to round back with this last, I don't want to kill too much time, but we're talking about starting right out of the gate with masks on, and then letting pool testing determine where that kind of runs. Is that?
No, we're saying start with masking out of the gate. Probably not do pool testing, but maybe just testing for individuals.
Right. I'm sorry. Do the other testing that Mary described, which I actually agree with that as well. That's a good approach. And then from that, it's going to just be a fluid situation for the school committee to redact or put the policy back in place as the year goes through. Is that kind of
my understanding, listening to them, that they specifically would look at least at a minimum every 2 months. I mean, could look more frequently, but at a minimum every 2 months, they would look at the data points listed. And I think we could recommend, Mary, to them total days missed from school as a good aggregate number for trying to achieve the objective. And it sounds like we all feel that we have to look at the big. There's one thing to look at specific data sets, but we have to look at the big picture of what's happening, with other variants across the state in terms of making a decision. And so I'm wondering, I know, Mary, you need to get to the school committee meeting that's meeting right now. I wonder if we should, I could make a motion, and I'd like to hear it amended if this isn't right. I could make a motion that the Board of Health endorses the school committee's approach of universal masking as described in the edited version of the Massachusetts Association of School Committee, and that we believe that the metrics ought to be viewed in the larger context of what's happening in the state and with the viral transmission, and not in any single metric. And that the one metric we could recommend adding would be days missed from school as something to track. So that would be my motion to summarize this conversation, and then to take back, it'll in the minutes, it'll go back to the board, the school committee rather.
Second.
Second, okay. In terms of votes, Paula,
Yes.
you agree? Carrie?
Yes.
Rick, yes. So that motion passes. So Mary, you can in live time, you can send that back to the school committee, even as they meet now,
Okay.
and convey our impressions.
You can
So I'm
run
hearing-
into the room.
That's awesome. I'm hearing that you support universal masking and also an ongoing public health assessment with multiple data points to see
Yes,
the effectiveness, including days missed from school, because we want to keep kids healthy, safe, and attending school.
right.
Okay.
That's right. You got
Right.
it.
Thank you.
All right, sounds good.
All right. Well,
Thanks
thank
for
you.
coming, Mary.
Very
Thank
helpful.
you
Great to
very
see
much. I
Thanks,
really
Mary.
appreciate the collaboration
Mary.
of all of you. Thanks so much. Take care.
Bye.
Bye. Whew.
Rick? Rick,
Yes.
I was sensitive of time the same way, Kevin was, but, there were other factors that weren't discussed, including, inevitably there's going to be a vaccine. And we did not talk about the effect of, improved ventilation systems and environmental conditions that might be feasible at some point along the way. So I wouldn't give up hope that there's on this single data point. And now that we've added one or two more, I think there's a bunch more that probably innovation will cause to come forward. So that's all I have. Thanks for letting me throw that stuff out there.
I know that the school has improved the ventilation. Last year, they put in better filters and so forth. Okay, next item was COVID select board policies with respect to COVID. And I thought we should bring this to the board just to have a conversation, and I'm not sure where, or how we should approach this. But basically, Peter spoke to Karen and about concerns about the in-person meetings of the select board, that the board meetings, if you've viewed any of these, they're far apart, and some have masks and some don't, and then the audience is out there, but the audience themselves are not necessarily socially distant or necessarily wearing masks. And, she just asked about whether there's, our perspective on that. And Peter, I know you had a longer conversation with her than I did. And I don't know if you want to frame this.
One of the points that we couldn't deny was, early in this, when I first got here, there had been a study done by our engineering department that measured all these meeting rooms and did pull together some information on, how many people they would accommodate.
Mhm.
So, there was always that piece. And I laced the discussion with her as much as I could that, you're not stuck in this particular room. Although, my experience in Reading is very limited, and there may be good reason why they want to go there. But so that came up, and she was open-minded. But I mean, we agreed on a couple of things, and one of them, it might sound trivial, but we're not going to do a knee-jerk reaction because a select board member asks us, pointed question. We'll be thoughtful no matter where the question comes from. And I'm not sure if Karen was asking, was expecting a decisive yes or no. So, it's out there. I don't know what the board feels like doing with it. My recommendations, and I think I tried to be as clear as possible in my response to Bob. And by the way, I do think the communications could be improved. I didn't think it was, not where I come from, there's one chair, a chair from one committee get the cut right across to a chair from another committee and start to, rattle things up. And as long as I guess I have the floor, it should have gone, as long as the organizational chart's in place properly. She should have contacted Bob, who would have contacted me, and I would have contacted our chair, and that's how the communications would flow smoothly. So she got that as well. I think we can probably be a little bit more passive than we were with the school committee right now, but that's just my thought.
So, I think that, it's important to be consistent. And so if we were to do anything formal, it should be consistent with every board, committee, and commission that meets in the town. Why would there be one set of rules for the select board and different ones for all the other committees that are meeting in person? Not to mention the fact that if I can go into Starbucks and there are 10 or 15 people there are no rules around anything. Whereas I go to a civic function like a select board meeting and there are rules. So there's, we haven't even addressed this on the public level. Although the CDC, actually currently we're an area of high transmission, indoor public places, people should be wearing masks, and that's a CDC recommendation. So, my own thought is that, Peter, we could informally, provide the select board with some options that they could consider. I think it would be up to the select board to decide their own meeting policy. Things like, maybe there ought to be, we ought to look at the number of people in certain rooms that's allowable, or 3 to 6 feet spacing between chairs of the people in the audience, or masking. I mean, those would probably be the key things, and if the select board wanted to move in that direction, at this point, that would probably be reasonable. But we can convey that informally to the chair, and if the select board wants to have it to further discuss it, they could do that. I just feel like unless we're willing to do a fairly strong mandate across not only civic functions, but indoor public places, as was necessary last March, a year ago, I think we can provide some advice and have them discuss it. I don't know, what do people think? Yeah, Carrie.
I just am curious, is there still an opportunity for remote participation for members and or people from the public? Yes, there is.
Yes to all of those.
Okay, all right, because that would be one of my concerns, is that somehow what are we saying? Sorry, constraining somebody's ability to participate, right? Yeah, I mean, I think that I think what you say, Rick, makes good sense. And I say that we should be following the CDC guidance, and the questions are about how much time do you spend with people who are not vaccinated, people who may be immunocompromised because of their age or because of illnesses that you are aware or unaware of. Yeah, I like what you're suggesting.
So maybe we should just leave it at that, and Peter, you and I can follow up, and you can communicate directly to Karen about any of those ideas. One thing about that struck me, just as an aside, about when we were talking about the school masking and the CDC and the American Academy of Pediatrics and so forth, these national organizations do sort of, in some ways, have to meet a national, they can't parse it out by what's going on in any one state or county or anything. I think the CDC tried to do that with this, high transmissible 50 per 100,000. But even if you look at Middlesex County, I looked at the Reading numbers today. We're at 9 cases per 100,000 on average incident rate for the last 14 days. That's way below the CDC guidance of, over 50. So even though we're in a county that technically is high transmissible, we're in a town that is fairly low compared, relatively speaking, although it inched up a little bit from last week. So I don't know. It's, there's science, and then there's sort of judgment and how much risk you want to take. And so I just feel like, even though those are the CDC guidelines, I wouldn't want to do that in this town unless we came closer to them at least. I don't know. It's just a thought.
Yeah, I understand that. I'd be interested in knowing about our about the sort of the how contained are our community members? What's the traffic patterns? There are an awful lot of people that are commuting into areas that are of higher transmission rate. So it's not, we can't be, what is it? We can't be Brigadoon, right? Where we're just there. That's the word. So yes, I agree that we have to kind of, you're lumped in with a number of other communities, and you get drawn up down by their activity. But I don't want to throw it. I don't want to be too sorry, why don't I have any words? I don't want to be bound, but just by the Reading numbers. I think that's great.
Yes,
But
I agree.
Yeah, it's tricky. It's a tricky thing to kind of, as you say, parse how to measure the relative activity. But we are definitely on the safer side in the county.
Yeah.
That's good.
Yeah, we are. We definitely
Yep.
are. Okay, so I'll follow up with Peter, and we'll follow up with the chair there. All right, so moving along, our next item is the MAPC project update. And I think Jean was going to, what's happened since our last meeting and where we are. And I think everybody saw the projected scope and proposal, but go ahead, Jean.
Yeah, in your packet is where we ended up. I won't go through all the gory details of how we got there, but we worked really hard and we got there. And so the materials in the packet reflect how we got there and some just very slight edits to the original scope that the board adopted and approved on May 20th of 2021. I did a bold and cross out. Some things changed. The subject matter expert, Sam Wong, took a big job with the state. So he's no longer the subject matter expert that was in the initial scope we voted on. So I felt it was important to clarify that. And I left it as bold and crossed out with a note there as to why that changed. Another thing that was in that scope that you voted on was the reference to an arrangement, some sort of regional with Linfield and Wilmington. Obviously, you know that changed. So I crossed that out too in the bold and cross out version of the scope. So that's the scope. I sent you, and I apologize if this is confusing, but I've been working with MAPC on finalizing, and they didn't get me something. So I guessed at what might have changed with regard to the timeline on the project. So there's just a slight update to the timeline that was in your packet, and it's not, because it extends the final report instead of being in January into February. So that's basically the big change. We've spent some time getting to this point, and MAPC felt as adding another month to the final work product was a good way to go. So I sent you that by email this afternoon. And again, I apologize for the multiple confusing things. But I couldn't wait anymore for MAPC, so I just gave it my best shot. And I was close. And then the last, the project outline was in there as well. That's just a high-level summary. But the important thing was the work plan. And the pieces of the work plan that we really wanted to identify were what would the peer community would be. And we had initially talked about peer communities, but we never really drilled down into a final set. So the final 4 that we are recommending in this work plan are Bedford, Danvers, Winchester, and Needham for the 4 peer communities. The list of who would be included in the stakeholder interviews is in your packet, and it's, you know, exactly kind of the thing we've been talking about, but it just drills down a little bit further. And then some example interview questions were included as well in the work plan. So that just gives like a deeper sense of what we're doing. Oh, and the subject matter expert, we have confirmed it's Pat Maloney. That was another thing that took some time to nail down, but we got there. It's Pat Maloney, and it's done. The contract is printed out on the town manager's desk for Monday morning. All he has to do is sign it, and all we need is an affirmative vote, and we are ready to go. MAPC was concerned because it's taken a little bit extra time, but I assured them that I would do my very best to get this done so that we can get to work when everybody comes back from vacation September 1st. And any questions? And again, this is the
Good to
internal,
me.
in case anybody is just wondering, the internal assessment of public health and the public health department now. So it's a sense of bringing people in and find out what's working and what's not.
Thank you for all
Good to
that
me.
work, Jean.
Thank you, Jean.
Thank you,
And Carrie
Jean.
and Peter.
Thank you,
you
Jean
all.
and Peter. It really,
And yes,
we did a
Yeah.
thank you. Yeah, it was a good process. I mean, I think we worked it through very thoroughly. Yeah, we worked it through very thoroughly, and we were thoroughly convinced, and then we said, wait, and we reassessed, and I think we're all happy. We all agreed that we came out at the place that was best for what Reading wanted to accomplish. So
I explained to MAPC, one of my favorite sayings is go slow to go fast.
yeah.
yes,
That's,
Yep.
that's my piece.
can I say one thing? So on the list of stakeholder things, there's, I think it says me as the board person, and I was a little, I'm happy to do that. We kind of struggled with the way, grappled with the way to, how do we best do this? And it seems like just having one person might work, as long as I can get feedback somehow without violating open meeting law, from folks of information that you would want to make sure was conveyed. So, I see myself as kind of a conduit. And I hope that that's okay with people, and I'm willing to do whatever it is that, and I really would like to know what people want to be represented in that conversation. So
I think it would be really helpful for if any of the board members have, ideas or comments about what they see are, the strengths and weaknesses of the health department, and anything else, any answers to any of these questions that are listed, to be able to get those in writing. I don't know if it'd have to go to Jean to give to Carrie because of the open meeting law, or is that, or can we send it directly to Carrie?
We'll have to figure that out.
Okay. And we have to know when the interview is going to happen, so people
Right.
have enough time to think
Right.
about that. So however that works out, if the board members can be notified when the interview is and who to send the feedback to would be useful.
Mark offered to come tonight. I didn't think it was necessary for him to come, but it shows that, the lines of communications are open. So I don't think we're going to have any problems, getting that part up and running. And I think it's legitimate that Kerry is the conduit, and we'll all have a chance, that is, the board members themselves will have a chance to influence Mark through Kerry on what they would like to see or hear.
I mean, Kerry, this is your wheelhouse, so I fully support it.
Absolutely.
Thank you, thank you, thank you, thank you for your confidence in me. I appreciate it, and I really, I'll do whatever I can to, whatever you give me, I will make sure it gets represented. So,
Great.
thank you.
So do we?
So we need to vote. Yeah, we do need a vote
Okay.
on the amended contract as presented tonight by Jean, dated, I think it's dated today, Jean?
It's dated today, and it's the one notation with that, the timeline change that you got in your email today. So it's the final product in February.
So I would make a motion to approve the scope of services and fee schedule for the MAPC project as dated in the document as dated and presented to the board as of today with the amended timeline.
And I would second that.
Paula, second. Carrie?
Yes.
Paula?
Yes.
Rick? Yes.
Yes.
All right.
Yay.
You know, I remember talking about this analysis last August.
Yep.
I think is when we first started the conversation. So.
Yep. It took a little bit. We had a little pause. We didn't have any bidders. We had this pandemic. Yeah.
Congratulations. I'm proud for our board. We did it.
Yes, we did it.
Thank goodness.
Thank you to all of us, everybody. Big thank yous. We got it across the line. Yeah.
Moving forward.
That's right.
All right. So Kevin, coalition update.
Yep. So there's a few things, not a ton to update you on with the coalition today. Most of it is just kind of ongoing that I've updated you before, such as when pull this up, the 2021 YRBS preliminary data report, that's still ongoing. It's still set for the 27th of September for them to present those findings. So that really hasn't changed. One of the couple, probably two things that really has a new update. One is the coalition operated intervention program called Chemical Health Education Program since 2012, and it's for to help students when it comes to dealing with chemical issues. And so they've actually worked in close concert with around 400 students since its inception. And so it was a good program, but they're going to be essentially adapting it, and we'll implement a new program into it, which is called I Decide. They'll be working with, in concert with the school nurses, athletic department, education staff as well. It's a tier 2 substance use intervention curriculum designed by MGH and in coordination with the Mass Department of Public Health for the Reading Memorial High School for next year. So essentially, this is going to be some new training that's going to come up for Erica and I should backtrack real quickly. The old outreach coordinator, that job has been posted and they're trying to fill that. So whenever that person comes on board, it's going to be an education for them to bring them up to speed. And all of this is basically, it's mental health, but it's also risk assessment, obviously, for chemical and substance abuse. So it's kind of a two-tier look at it. And as part of it, they applied to the National Council for Well-Being to become a new site to bring teen mental health first aid program, which is right now, they have money that they could put towards grade 11, but this program actually is a 10, 11, and 12th grade program. So they're trying to get some more funding so they can do all three grades. And it's really good, I think, in a time when, coming out of this pandemic, mental health, as everyone has said in the past, is really the next pandemic, and the kids are probably the most susceptible to that. So this would be really great if they can get the funding for it. They're still going to go through and get the training done for it. That's a thing that's going to happen. So they'll at least be up and running. And if they only can get grade 11, they only can get grade 11. But hopefully they'll get the funding so they can get more than just that one grade in there. So that was really the biggest thing that I thought would be a good update for this board. Everything else, like I said, is just kind of what I've updated you before. There's some ongoing programs that are out there that they're kind of collecting data on. The community justice project is with the Woburn District Court. This is the project where they're trying to figure out how do we make it so these folks with mental issues aren't making it into these courtrooms. Instead, there's an intervention before it gets to that point. So that's an ongoing program that they just started, reported to me that I think a month or two ago in one of those meetings. So that is still ongoing. They're still collecting data for that to see what resources they can help out in that regard. Let's see, anything else? If you have a question, shoot it out at me. I'm just looking if there was anything else of interest I wanted to point out.
Right?
You know, I have a, I always.
I know you do. Go ahead. I think that's all I got.
And I don't know if this is in Erica's agendas or not. I was just curious if there's been any update on the filling that mental health position that was created at town meeting. I know Erica was part of the search on that. Did that come up with their work?
It did. Thank you. I
Yeah.
knew there was something else. Carrie, you nailed it. Yeah. Hold on. Let me get back to that. So they have been meeting with clinicians from Wilmington and Burlington. That's the latest thing that they've been doing to discuss their daily responsibilities and lessons learned.
Okay.
They're trying to, find out the good, the bad, the indifferent, because those are up and running similar setups that we're looking to do. So they review the job descriptions and clinical protocols. And right now, Erica and the chief are going to be working on and doing all their due diligence before they launch the hiring. So they still have some more. I don't think we're going to get an answer. My meeting is next Wednesday with them. I don't know that they'll have much more of an answer. I think they're still collecting information from folks so they can, if they're going to put it out there, they want to get the best possible position put forward that's going to do the most help for the town and its residents, what have you. But yeah, thank you for reminding me that is at least moving, which is
That's
good.
great to hear. Yeah, because it was kind of what's the model going to be? That was so they've settled upon a model, and now they're in the kind of discovery there. That's great. I'm glad.
Well, I don't know if they've 100% settled upon a model. I think they're more still collecting data, but I think they're leaning in a direction.
Hopefully they will, as they draft a job description plus model, hopefully they will, before they finalize it for posting and recruitment, they would pass it out to sort of key constituencies in the town, which I think the Board of Health is one, but not the only one.
I don't know if this is Peter on my screen. I don't know if it's Peter on yours.
It's actually Rick on my screen. But
Okay.
But I am here and I'm listening and I'm smiling. Thanks.
Okay, so is that something, maybe Peter can talk to Erica
on
about?
Wednesday.
But I could see that, presumably they're getting feedback from public safety and the schools and, maybe some community groups. There ought to be a little bit of an input process once they at least have a draft of the direction they're going in.
Sure, and it's a smart idea to go talk to the towns that already have it. My old thing for Reading is I've always gone on one assumption: don't try to reinvent the wheel. Someone's done it for you. They've messed it up and they figured out how to do it better.
Yep.
Impeccably bad timing. I'm in the middle of a Zoom public health meeting.
Yeah.
Excellent.
But, unless there's any other questions on anything related to that, that's my update for you. I'll have another one next month.
Carlo.
Gary, do you have a comment?
I was just going to say thank you, Kevin.
Thanks, Kevin.
No, you're welcome. No worries.
Thanks.
Happy to do it.
Carlo, did you have something?
Yeah, thank you.
Yes.
I don't want to step on Kevin's toes, but I heard that
Please do.
I heard that they want to replace Sammy first. before they do a full dive
Yep.
into a mental health director. So I just wanted to add that.
That's helpful.
Yeah, that makes
Thank you.
sense.
And it
Yeah.
does make sense. Yeah.
That's smart.
Yeah. They've lost
That's good to know.
capacity. Yeah. So that's good. Okay. Thank you.
All right. Peter, health. Actually, it says health division, but isn't it technically a health department?
Sheepers, nice catch.
Oh,
Yep.
Sorry about that.
Department monthly report.
Yeah. I don't think I won't bother trying to change it now, but I will screen share this. It's okay. And yeah, it still says health division. Can everybody see that, please?
Yep.
yes.
All right, so we'll put it right down. Before we get started with anything, that phone call, and it was rude for me to just grab it, but I was expecting an important call coming in from one of our restaurants. I don't know if anybody heard about Chipotle. We will be hearing about them later in this report. And it's kind of an interesting one. It doesn't happen every day, but I'll fill you in. But let's move right down the line here. First of all, in the epidemiology section, we have the COVID-19 case count and so forth. And Christine's well prepared to talk about that. And if you'd like to share the screen, Christine, I'll butt out, or you can just go by what you have.
Sure. I'm calling in. Sorry about that. I'm calling in this evening. So if I could just go based off of what I have.
Yeah.
I did forward a report earlier to you today. I'm not
Yeah.
sure if you can share that. But COVID data is per Maven reporting and subject to change. The information is data over the past 14 days, 8/5 to 8/19 today. Total case count is 1,993. Our active cases are 31. Deaths are 50. It had been 49 for many months. There was a death back in May, and there was some delay in that reporting. I did confirm it in vital statistics, and our stats have been updated for the town. Transferred cases remain at 10 and recovered 1,902. At the present time, with regards to clusters, there is a home daycare. It's a family operated daycare. There is one positive staff member who is the owner. She is fully vaccinated with mild symptoms, and there are 5 children. All 5 children are asymptomatic, and testing is pending. Daycare has been closed, and the Department of Public Health has been notified. A cluster has been created in Maven, and monitoring and surveying notified earlier today about a potential cluster at another home daycare. I'm working closely with the daycare owner and the Department of Public Health, and active monitoring is ongoing. If I could just make a brief comment with regards to collaborative efforts. It was really nice that we, as a department, got a chance to meet with Mary last week. I think she's a wonderful nurse, and she's been extremely instrumental in assisting with any type of contact tracing with regards to children at school, students at school. And I feel that we work very well together, and I look forward to continuing working with her. We have an upcoming meeting next week with Elise Warren at the Senior Center. So these are people that I worked with throughout the pandemic, and again, were very instrumental just with, at the height of the pandemic. So just continuing any type of collaborative approach I can make with other members of other departments is important to me. And I would say that I did forward some information. I had a brief discussion with Mary earlier, and she said it would be good if I could provide her with any demographic information with regards to trends. And I did break it down to age group, vaccination status, and household contacts. Mm-hmm. So it does appear that approximately a little over 55, about 57% are household contacts, and close to 50% are fully vaccinated breakthrough cases. No hospitalizations. There is no cases at the present time that are over the age of 70. And yep, I think that's about it.
Thank you, Christine. Any questions about that? We can move on to Maven if there isn't, and one might overlap into the other.
Right.
Did you intend that report, Christine, to include part 2 up here under epidemiology with the Maven pieces and so forth?
Would that be just like the data over the past week?
I'm not sure.
Yeah.
I'll tell you, I got really distracted later today. And
no, I mean, I included the case count,
Okay.
the amount, any clusters. Yep.
okay. Kerry?
I've got a question. Just quickly, so contact tracing, I know, you all were talking about the contact tracing capacity, and the school nurses are going to continue to support with information about any in-school cases. And then they were more actively involved in during the school year last year, and that's not going to be the case. Is that right? Yes.
Yes, that's correct. So pretty much the protocol that was decided upon is that sometimes, as Mary had stated, cases are identified before they hit Maven.
Mm-hmm.
And with the Department of Public Health not reporting on the weekends right now,
Mm-hmm.
Sometimes there's a delay or a lag time in the data being provided from Maven.
Yep.
So oftentimes Mary is informed, or the school nurses are informed, or someone, has been notified by a lab, and they'll either give myself a call, the public health nurse a call, or they'll let the school nurse know.
Mm-hmm.
The protocol that we have established is that if someone is identified as either positive or a contact, Mary will let me know. And if and I will do the contact tracing, or Shuang and I will do the contact tracing. And if we identify someone in the Maven system, we will then report to Mary, and she will then inform her staff.
Okay. Okay.
I do know that. I'm sorry. Go ahead.
No, I was just said good. You're at a disadvantage. We're all sitting here nodding. You can't see us, but we can.
Next time, if I'm invited, I will make sure I Zoom in and not call.
No, I'm not. That's not a critique. I just you're fine.
I would just say I've had a chance to meet with the CTC, the Contact Tracing Collaborative for the Department of Public Health. The liaison for the town of Reading, her name is Sandra Aronson.
Mm-hmm.
And I'm sure many know the CTC let go of a lot of people. They have then brought back a lot of people. At this time, I'm being told that we can certainly utilize the CTC. However, they do have about a 2-week, so I don't want to say that they're behind, but they're just getting people up, brought back in and trained. So, but with that being said, she is definitely there and able to assist in any way. She can get us in touch with an outbreak specialist if we have difficulty obtaining a roster from, let's just say, a sporting event, whether it be at the school or recreational.
Yep.
She can certainly get assistance if that's needed at any point in time rather rapidly.
Okay. So the backup source is still a little constrained, but I know because their contract was supposed to be ending September 29, and then they were informed about 3 weeks ago that they would not be, that they are now extended through December 30. So
December.
Yeah, in anticipation of Delta Gamma. But it sounds like they're not necessarily right up to snuff at this moment if there suddenly were to be a large number of cases for you and Schwung to be managing.
Correct.
Okay.
Yeah. And again, with regards to other departments, I know that we have a scheduled meeting with the senior center too next week, just to discuss protocol, like we did with Mary's, just sort of figure out how, how to work best with the senior center and what we can do, how we can help each other.
Great. I love that. My preparedness heart is so happy.
We'll have a little
And
more
also-
details. I'm sorry, go ahead. Yep.
Oh, no, also, if I could just briefly mention that, I have been keeping track too of any type of, I know you had mentioned, Terry, long haul and
Yep.
that type of information. I don't have much at this point, but I have been keeping information about potentially 2 right now.
Okay.
So more to come.
Okay. Thank you for that. Thank you, Christine. I appreciate that. Yeah, I just don't know what the incident is. And thanks.
Kevin, you
Looks
had a
like-
question?
Thanks.
Yeah, real quick. Hey, Christine, it's Kevin. I just have
Hello.
a quick question in regards to, it's a 2-part question, I guess. You said we're at 31 right now. Are you seeing consistency week over week with the numbers, or is it, has it jumped up? And then also in the same light, remind me of the protocols you folks have to get someone off the active list. How many days,
So,
I would say.
Yep. Yes. So I'll just back up. So I have been seeing an increase in cases. I would not, over the past weeks, they have gone up. Prior to that, they were low. I do predict that, I will say, just from speaking and doing the majority of the contact tracing, that many people are just returning from vacation. I have a list of locations and states that they've been to. This was talked about a little bit earlier on tonight. There are some states that are of higher transmission and % positivity, and then they're coming back to Massachusetts. So I'm collecting that data and sort of looking at it separately. I know that could be a potential. So there's the vacation. There's also household transmission. That seems to be one of the main causes of the spread. And it's very difficult for the young kids to isolate from quarantine from their parents. The parents sort of have to be there. And so that's what I'm looking at right now. And I'm sorry, what was the second part of the question?
The second, what's the protocol to get somebody off the active list? So we have 31 on there. Is there a simple timeline factor, just a simple
Yeah,
day?
it actually is a couple of factors, because someone's quarantine can be, I'm sorry about that, someone's quarantine period can be extended if they're in a household, if they're vaccinated or unvaccinated. So there are some variables, but essentially someone's isolation period, you can work it 2 different ways. You can either base it off of symptom onset date, or you can base it off of test date. That would be day 0, and then you would count 10 days due to exit on the 15th. That's their isolation period. I guess for someone that needs to quarantine, it's a little bit different than isolation, and that's where it can be either extended based on the situation.
Mm-hmm.
Okay. Thank you.
Sure.
I'm not sure if that's all Christine has to say, but if it is, I'll just give her a plug right now for for her networking ability. She did not mention the meetings that she holds routinely with Austin Prep, beyond the CTC, and with the professional organizations of public health nurses. I really am confident that she's on the cutting edge all the time with what's happening out there. So that was a good question, Kevin, and I think she probably managed it swell. Only I'm not a clinical guy, so I'm not going to challenge any of that. I do know that the protocols have changed, and she was right on top of that when Jean asked earlier I think it was this week, for we're starting to get people in town hall that wonder when they can come back to work and so forth. So we have that. All right. So with that being said, if there's nothing
Paula,
else,
did you have something?
I did. I had questions about,
sorry.
Christine, have you come across any cases with organizations such as Boy Scouts, any of the sporting events or anything like that? Do we have to be looking at that kind of stuff like we did before?
Yeah, surprisingly, and we are keeping close eyes on any type of camps and sporting events. There have not been many outbreaks or clusters in these years. I'm not sure if it's because the majority of them are outdoors. I think when school starts, that may be a different case, but
Yep.
Okay, thank you. Just wondering.
Sure.
Anybody else? Because I can only see like 4 or 5 at a time here. And if so, speak up. But if not, let's move on to Schwung, who's going to talk about the vaccination programs. And I'll cut off of this. I'll stop sharing because I think you have something. Am I right, Schwung? You want to put it up?
Yes.
Thanks.
Okay. Can you see my screen?
Yes.
Yes, thank you.
Yeah, so I'm gonna talk about the COVID-19 vaccine updates first. So in early August, FDA authorized an extension of the shelf life for the Johnson & Johnson's vaccine from 4.5 months to 6 months. So which means our leftover 6 vials Johnson & Johnson vaccine, their expiration date has been extended to September the 21st. We have COVID vaccine clinics every Tuesday morning from 10 to 12 at Senior Center, and we did receive residents call in asking for the vaccine, and they come and get the Johnson & Johnson vaccine. So it's getting slowly to utilize these leftover vials. So hopefully by the time when reaching the expiration date, we can use all of the Johnson & Johnson vaccine. And with regards of the Reading vaccination rates, so this table is from the mass.gov official website. It's as of August 12th. So in Reading, we have 1 dose vaccination rates. The total is 70%, and the fully vaccinated rates. So here I would like to explain one thing that you might have a question, because if you look at the age groups from 12 years old plus, they all above 70%, but we got 70% as the total rate. That's because when the state calculates the vaccination rates, they include the age group 0 to 11, which has about 15% of the total population. But however, that group, there is no COVID vaccine eligible for that group. So when they contain this group, so they get a relatively lower vaccination rate compared with other age groups. So the same as the fully vaccinated vaccination group. So this is one thing that I want to clarify on the data.
Can I just add one other thing?
Sure.
Just
Sure.
on the fully vaccinated group, ages 20 to 49, those 2 rows. It's interesting that they have the lowest vaccination rate, and those are the ages of, typically the ages of parents of kids in school.
Mhm.
And so, that just another factor in thinking about masking, because a lot of times it's the parents that get it and give it to their kids, who take it to school as opposed to the other way around. And, this age group, which is, working parents and so forth, yet they're the ones who are exposed to children. So I just want to make that comment.
Thank you.
Could I just also make a comment as well? That's the age group right now that is typically the highest, from 20 to 49, 20 to 50. That's the highest, the largest percent that is positive right now.
Interesting. Yeah.
Yes.
Vaccination
So,
works.
Yep.
yes. So anyone who's 18 years older, please contact us and get, vaccines. Okay. So next is the flu clinic preparation. So on Wednesday morning, the Commonwealth Medicine hosts an annual training session for the about the vaccine reimbursement. So they mentioned effective on September the 1st, which is the first day of next month, Commonwealth Medicine will no longer accept paper claims submitted in the mail. So which means everything's going to be online. And as you may remember, we use PerpMod as the platform for our COVID vaccine clinics. And now we are not using PerpMod for any new clinics. And we are doing a transformation from PerpMod to Color, which has the similar function as PerpMod. So the public can book and schedule vaccine clinics. And we, as the provider, can submit the data to MIS, which is the state immunization, information system. And Commonwealth Medicine can bill the health insurance company from that platform, from the data that we submitted. So I just want to inform you that our Reading status of color application has been completed, and they are hosting training sessions every Monday and Wednesday afternoon. So I plan to attend the trainings in the following weeks, and I will keep you updated with the information. And with regards of the flu vaccine clinics in Reading. So as you may know, we ordered 560 doses, which also includes 120 high dose for 65 plus years old people in March, and the flu shipment will arrive in October. So in regard to flu vaccine distribution, so we're gonna give them to, seniors, school staffs, first responders, and affordable housing. And Jean also introduced John, who's the former Board of Health chair. He's also a pharmacist with CVS. So for the rest of the residents, we may consider to collaborate with CVS for, on the flu vaccine distribution.
Excuse me, Shuang, but it's worth taking a pause here because 3 months ago, this stuff was just, or maybe 4 months ago, just a concept. It's all coming into play now. And, I always put the nurses on a pedestal and for good reason. But Shuang's doing a really good job of getting up the learning curve. I mean, I'm never going to forget when PrepMod came out, we weren't even close to being ready. We had no clue. This time we're well ahead of the learning curve, and that's great news for the town.
Yes.
Thank you, Peter. Next, I would like to discuss with our Board of Health. So regarding the website post of our case numbers. So in our previous meeting, we had talked about post the case number as needed. And our house would like to, host two state websites. One is the COVID-19 interactive data dashboard. That's the dashboard that Dr. Lopez mentioned earlier in this meeting about 14 days average daily incidence rate. And it also includes the case count and the test count. So, the public can find more information, not only for Reading, but also for other towns and cities on that website. And they can compare the data in different locations. And, if they want to travel to some place, then they may have an idea about their case count or, COVID information on that website. And the other website we would like to post online is the weekly COVID-19 municipality vaccination data. That's where we find the, the data that we generate to this table. So it includes different demographic categories with different towns and cities vaccination rates. So it's the public will find a spreadsheet of the data, and they may, get more relative information on that website. So along with these two links, we would also put a sentence saying the board continues to monitor the case numbers and will report as necessary. So our current date of the case number on the website is August 5th. So we are going to post that and pause that and then put these two states websites and a sentence on the COVID dashboard on our town hall website.
I can tell from the body language that everybody's tuned in, and I hate to be redundant, but that first line under parentheses and with italics is directly from the minutes from a couple months ago. And prior to that, we were posting, well, we stopped posting, but then like a year ago, we were putting up numbers, raw numbers every week, and we decided not to do that once we reached a certain level. Now as it's climbing up, we weren't sure how to handle it. So we came up administratively with an idea to just connect them to the state website. And if people in town want to know, they can get it that way. And now, as necessary, the board should think about it. We're going to meet again in 2 weeks. What does that mean to you folks? I know what it means to me, and it's going to be a very fluid thing, but we talk together and decide, okay, I think it's time we put up some new numbers. But that's something that we could probably use a little bit of big picture direction from the board. But I wouldn't ask you it blindly now, but maybe next time we meet, what does that piece mean to you? How often do you want to see the numbers going? Thanks, Ron. Keep going.
Yeah, no problem. Thank you, Peter. And the last topic I would like to share is, the foundation course for local public health practice. So, Paula and I are taking the modules from Boston University, the training website. And the course have 4 parts, which including the introduction about, emergency management and health promotion, legal matters, environmental health, and the community health. They are the main parts of public health. So like discussed with Paula, we are going to cover 1 or 2 parts with some highlighted points in our future Board of Health meetings. And, our goal is to increase the awareness of public health, educate the public with practical instructions and resources. So, if anyone if at any time point people get involved in any public health matters, so they may have some basic knowledge and resources they can refer to, so for deal with their situation. So
And this is okay. Yeah, finish up,
yeah,
Schwung, and I want to take the ball.
I'm just wondering if Paula would like to.
Well, yeah, I was going to say before we did, this is all exciting stuff. If the board would allow Schwung and Paula to sound off before the meeting, but Paula came up with an idea that it like blew me away. So turn it over to Paula and see how this one flies. I like it.
So my thought was, as I was doing these foundation modules, thank you, Carrie.
Yeah, but
Lots of people, but I'm glad you like them.
Yes, well, they just seem to lend themselves to public education in general, and especially in light of the recent housing issue and the inspections that went on there and found subadequate housing situations, to educate the public and to give them resources if they find themselves in that situation, or if they know of someone in that situation, let them know what their resources are. So if you know a hoarder, or a hoarder has self-identified, or somebody has mold in their house and they don't know how to deal with it. But those kinds of modules that they could be presented even on RCTV by someone, myself or Schwung or anybody who would be interested in doing that. And this would be another step towards excellence in public health for the town. That was my thinking.
I mean, that just blows me away, the idea of it. And Paula is enthusiastic. She doesn't show the enthusiasm right now that she was in my office the other day, but she's gung-ho about getting this. So if anybody knows anybody at this cable TV programming area in Reading, we could probably use some help getting in the doorstep. But I agree with her. I mean, a half-an-hour show. They're doing stuff on there all the time. This is worthy of it, and I could carry on, but I won't.
It sounds great.
Yeah, it's a good idea.
You like it? Okay. Well,
Yeah, I think it's a great idea.
With it.
It's a great idea, Paula, and I will tell you that is not one that we have heard of anybody doing with our trainings yet. Doesn't mean it hasn't happened, but I believe it's a novel idea. So I'm going to be sharing that information, and you may find yourself in our newsletter.
Well, I did wonder about, well, I wouldn't, steal the information. I would paraphrase and stuff like that. I can.
It's not even, you can't steal it. So
okay.
It is funded by, it is in the public domain. It is the intellectual property is owned by the Commonwealth of Massachusetts. We're the holders of it. But part of our contract is these are public sources to educate the workforce and, workforce adjacent and anybody who's interested. I love it. That's great. That's
this
great.
is such a powerful team when it comes to this, when you think that Carrie is behind it all and Schwung is working at it with Paula in tandem, and now we want to take it to the next step. I'm excited about it, but really anything else you have for now, Schwung?
No, anybody have any question? No?
Nope.
Okay, I'm gonna stop share my screen. Oh, Karen, you have a question?
I sent Peter an email after our last meeting because I was so pleased with how staff presented and engaged in conversation, and we kind of tossed a lot of different things at you, and I want to just say it in open meeting that it's just I really appreciate all of the work that I see everybody doing and being responsive and expanding areas, and just learning and learn prep mod. Now you're going to learn color, and taking on the foundations training. You really it's really wonderful, and I want to commend you guys. So
thank you,
Thanks,
Carrie.
This is really exciting for me, an old timer in this business. What does it take to get somebody like me psyched, continually psyched up? I'm there, totally there.
Okay.
Back to the issue at hand here, so we can go down. Now the lofty stuff is mostly out of the way. Let's get down to the bread and butter. And some of this is as crazy as can be. so the inspections, and Daniel's been out for 2 weeks, so I'm hoping to get most of this right. It looks like we've done 14, but I'm not sure if all these add up. It doesn't appear that they do. Dennis has done, and the reason it looks like he's done only 2 this month is because he turned so many in last time, and we got to get them synced up so it looks like they're doing more than just 2 between times. But this is what we're covering so far in this column in the year to date. John, unfortunately for us, John has decided to resign as our contracted service. He just doesn't have time anymore. And we took that in stride. And Gene and I have already begun some planning to get another contractor in place. So I'll be working on that the first of next week. So we've had some complaints in food, and I didn't even update it since today. We've got the newest complaint, and I don't know if anybody heard about the Chipotle problem that went out there.
No.
Lucky me. It came to my attention last Thursday. Daniel was out, so I put it to him, and I actually did some extra work, looked up some, how much is this poor Chipotle put into food safety over the last decade or so, and there's a lot. I can go into the details, but I won't. But what happened here, and I'm going to just say it because it's a public record right now, and I'm deep into it. A customer purchased a burrito, and it was delivered. And when one of the kids in the family bit into the burrito, there was a wiping cloth in there from the kitchen that was wrapped in the soft, shell of taco shell, whatever they call it. I just thought it was weird when I got it, but today it's down to me and with pictures, the actual. So the first thing I thought of, this is a deliberate effort to harm somebody. And in my training over the years, although I don't think I've ever had one, you need to include the police at this point, which Bob agreed with, and I contacted the police. We said they'll only take it after we've done some initial investigating and then want to turn it over to them. And then that was wise because I began the initial investigating, and the lady from corporate, she must be in another time zone because she called me just a little bit ago when we were here. I was hoping to get them to come tonight to talk about what they did, and I'm going to read a couple of my notes. I began with the manager at the store here in Reading, and he didn't like the way it was handled, and said the best I can do is send you up to the regional manager. We called him a field leader. The field leader told me that this was a training exercise. When new employees come in, they use a wiping cloth, a dish rag, whatever you want to call it. In my code, take the outside covering, the burrito sort of thing, tostita, whatever it's called. Forgive me, I'm not a big, I don't use that stuff much. And they wrap the cloth so they can get a feel for how do you make one of these burritos. And in this case, that training tool got put in the line and got sold and delivered. The kid bit into it. She tasted soap and wondered, what the heck is this? And so you can imagine what kind of has gone on. I said, well, was there a report made? Was somebody disciplined? I mean, otherwise we can't overlook this. It still might become a criminal case. They assured me that it wasn't, but he sent me to his now corporate safety, security, and risk at the corporate level. So that's the SSR. And they deal with this stuff. And I was waiting until it just showed up, as I said, 20 minutes ago. But this is going all the way to the top to find out, how did this happen? What kind of documentation is this company going to put in place so that we have it covered? I'm pretty sure the darn customer is looking for some kind of finality to it. And anyway, this is outstanding. It's worth throwing out there. It's a little bit of drama and trauma for that matter. We try to steer away from that whenever we can. But in this case, it was in real time. And I thought you'd like to just hear how crazy is this job? we've had some animal complaints this month, and I changed this heading up here from complaints to requests for actions. So 3 of those camps, we had 1 complaint. Year to date is 2. We had a hazardous material request for action in a real estate transaction. They called in and we had to go scour through our files to find out about that. Housing is always the most difficult part of the job. As crazy as the food things might be, you can get through those. The housing oftentimes is difficult. We have 2 outstanding housing going on right now, and sometimes they're sad. And this doesn't include what's going on at on Main Street. Pests, we're getting rodent calls more frequently. 1 in a restaurant that we will avoid the drama and trauma on, but should get a full write-up by next month on that. And some solid waste where the trash starts to build up. So there's our report there. I can forward this to folks if you want to critique it. I don't know, real time now, it's almost 9 o'clock. You'd be interested in doing that. If you do want to see some changes to this, and we do tweak it, it seems, from month to month, I'm happy to keep it going. I think it's a good tool that Rick kicked off, and we continue to work it. So now moving quickly along, there's nothing under the public health emergency preparedness. There is some stuff under community health and prevention, and the Maven update that Christine only alluded to, and Mary for that matter. We're trying to pull back on the number of people who have access to Maven. It was almost a year ago that I began. When I got here, we were getting reports from a number of different sources. It was ridiculous. We were trying to keep it together when we were with command, and it was hard. Until we got Christine inserted as the lead public health nurse, and everything was going to go through her from 1 source, did we start to get some credibility at command. And now we would like to kind of reduce the amount of access to Maven, where people can go on. They don't need it. We do have deeply appreciate our partners that do the contact tracing, but they really don't need Maven to get on there. So Mary Maven, Christine Maven, and Schwung should have Maven as the safety valve. She's not doing contact tracing yet because she's just out straight with so many other things. The assessment update, we had that from Jean already. Foundations, we just had that from Paula and Schwung. The website from Paul from Schwung. And the final good news, a good way to probably wrap up the evening, unless there's more questions and comments to go through, which I'm happy to take. But we have animal control services now in place after voted by our select board earlier this month. And I think that's a big deal too, because we had none before. Now we have something. Police will play, and the town clerk will play with this contracted service that we share with Wakefield. And it's pretty good. Things are going really well right now. Any comments, concerns?
No, thank you for your continued hard work, Peter.
Yes.
We'll be talking more about that next time we meet in 2 weeks, because the clock, the sands of time are,
yes,
continue to move along. And but I hate long goodbyes, so I'm not going to go there. But this is very rewarding to an old salt like myself. I really think Reading has what it takes to be a great town, and especially with what's happening in public health right now in the public safety sector and with the behavioral health. Just there's too many good things going on to let it up. We have to stick together. That's it.
Thank you, Peter.
Yep. Thanks, Peter.
Thank you.
Peter, you retired before a 100-year pandemic. You must have felt jealous that you weren't in the action after 30 years of practice.
It was a moral dilemma. I've said it plenty of times. I wondered what the heck, but I did get my share of it now. I'm getting tired though. I realize I'm old. I can't run 3 miles anymore. I can't do this even part-time. Wearing me out.
Well, yeah. As long as you can continue to do 18 holes.
That's all I want to do.
Nice.
All right, so to wrap things up, minutes from July 15th that came out, any edits or suggestions or changes?
I didn't see anything.
You didn't see anything? Okay.
Nope.
Nothing.
So I make a motion to approve the minutes from July 15th as submitted. Do I have a
Second.
second? Paula,
Yep.
second. Roll call, Carrie,
Yes.
Paula,
Yes.
Rick, yes.
Thanks, Jackie. Another good job.
Indeed.
A
No.
silent partner out there. We couldn't do it without her either.
No.
No way. No way.
All right, so with that, unless there are any final comments, we have a meeting in 2 weeks. This was a very good meeting. This was very robust. There were a lot of issues addressed. We finally kicked off the MAPC project. And so, 2 weeks is not that far from here. If people have thoughts around agenda items, please get them to Peter and we'll connect. I mean, if it's very thin, we might cancel it, but we might still have an hour or something just to connect. We'll see how it plays out.
Okay.
Okay. Sounds good.
Okay.
All right, motion to adjourn.
Second.
Zoom might have a
Cook's on you.
thing that just lets you know who talked first, by 1 millisecond.
Coke's on you, Carrie.
Roll call, Paula,
Yes.
Carrie,
Yes.
Rick, yes. Good night, everybody.
Excellent
Thank-
meeting,
Good night,
everyone.
Hey, everybody. Good to
Thank
see
you
you.
so much.
Yeah, nice to see you all. Take care.
Good night.
Bye.
Bye-bye.